Hi everyone, welcome to Run Mom Run, a pediatrician's guide to health, bonding, and fitness. I'm Dr. Lourdes Mosqueda, also known as Dr. Yuli. I'm a pediatrician and founder and CEO of Yuli MD, and I'm your host. This podcast is all about pediatrics, covering everything from child development and medical topics to family fitness, mindfulness, and practical parenting tips. We're kicking things off with a 10-part series on child developmental milestones. We're breaking down what to expect at each stage and how to support your child's growth. After that, we'll dive into a wide range of topics to help families raise happy, healthy kids, whether it's staying active together, understanding common childhood conditions, or incorporating mindfulness into daily life. I'm so excited to take this journey with you, and so let's get started. We are going to kick things off with this very first episode, Understanding Milestones, a parent's guide from newborn to 3 years. So in this episode, we will focus on developmental milestones. What are they and why they matter? We will review an overview of child developmental stages from newborn to age 3. We will discuss a little bit about the importance of early care and recognizing delays. And we will finally conclude with frequently asked questions from parents. So what are developmental milestones? By definition, milestones are benchmarks that we use to help track a child's progress in key developmental areas. Now, every child develops at their own pace. Milestones are a simple guide that we use. They are not strict rules. And again, every child is different, but these developmental milestones matter because they help parents understand what to expect at each stage. It provides insight into whether a child is on track or may need a bit of support. And it can strengthen that parent-pediatrician communication that is so important in these early years of a child's life. Let's review the different child developmental stages. Physically, a newborn will develop from spending time on his tummy to rolling over and holding his head up by the time he's about 6 months old. Cognitively, a newborn will start with recognizing parents' voices, following objects with his eyes. As far as his language skills, he will develop from cooing to responding to sounds. In the social emotional arena, she may go from smiling to smiling in response to interactions. The 6 to 12 month stage, physically, an infant will begin to sit up, then crawl, and then begin to stand. Cognitively speaking, babies will develop object permanence and start exploring their surroundings. As far as language, a baby will develop from babbling to responding to their name. In the social emotional realm, they will begin to wave bye-bye. They will begin to play simple games like peekaboo. Once we get into the 12 to 24 month age range, physically, an infant may begin to walk, climb, and feed themselves. Cognitively speaking, a 12 to 24 month old will start to problem solve and follow simple instructions. Language, they will begin to see a few words and start to point to objects when named. Social emotionally, they will begin to imitate adults, showing preference for certain people or certain toys. Once a child goes into the 2 to 3 year age range, your child may start running, jumping, and will have improved coordination. They will start to pretend play and understand simple questions. They will start to speak in short sentences, and they will learn new words quickly. They will begin to show independence and start to play with other children. Why is early care and monitoring developmental stages, why does this matter? This matters because we will begin to spot potential delays early, and this will help us determine when is this important, when should we be concerned, or when should we kind of wait and watch. There are certain signs that may indicate developmental concerns, and early intervention is beneficial for children. The earlier we recognize a delay, the more effective the intervention can be. This is where your pediatrician and specialists can help. What is the role of a parent or the guardian of the child? Well, parents can be very supportive in the development of their child. They can engage in simple activities to encourage growth in each area. So again, the importance of reading. Have a bedtime routine that includes reading every night. It's never too early to start reading to your child. Talking, and during playtime, being a role model during these moments is very important. Let's talk about the frequently asked questions that I get from parents. One question that I hear is, what if my child isn't meeting his milestones exactly on time? And again, every child develops at their own pace, and there may be slight variations, which can be completely normal. Some children may reach milestones early, other children may take a little bit longer. So we're looking at the overall progress of a child. Rather than hitting each milestone at an exact age, we kind of look at the overall progress. However, it is important to notice significant delays, and especially it's important to notice any regression. So if a child is losing skills that they previously had, then this is definitely worth discussing with your pediatrician. And again, your baby's doctor it is important to continue your wellness visits with your child's doctor. During these wellness visits, your pediatrician will monitor every child's milestones. They will review the motor skills, the language skills, the social skills. So these wellness visits are important for your child so that we can continue to monitor the development. Another question that I get asked quite frequently is, what activities can I do to encourage my child's development? So for the newborn, tummy time. Tummy time is important. It strengthens their neck muscles. Talking to your baby, singing to your baby, this will encourage language development. For your 6 to 12-month-old, interactive play peekaboo, play patty cake, and again, reading books. The other things you can do is encourage crawling and pulling up, so give them plenty of time on the floor to encourage these activities. In your 12 to 24-month infant or child, stacking blocks, pointing to objects when named, encouraging simple words and gestures. For your 2 to 3-year-old, pretend play, playing with puzzles, singing songs with hand motions, encouraging independence, for example, with dressing and feeding. You can make these fun. You can make these engaging. Give your child plenty of encouragement. When should I bring up concerns with my pediatrician? That is another question that I'm asked often. I think it's important to bring up your concerns with your pediatrician whenever you feel uneasy about your child's development. It's okay to ask your pediatrician. Your pediatrician or your baby's doctor is there to support you and your child, so do not hesitate to ask questions or to request developmental screening. So if you have any concerns, talk to your baby's doctor about these concerns. In closing, milestones are a general guide. These are important guides. Early care is important. Trust your instinct as a parent and talk to your baby's doctor if you have any concerns. Don't forget to subscribe for upcoming episodes on specific age milestones. Join our email list for health tips and milestone tracking tools. Don't forget to follow us on social media. We will continue to post updates and parenting advice. Please enjoy the journey of parenting and celebrate each milestone along the way.